Hi everyone, my name is Emily, and welcome back to Doctors Who Wear Pink. Today I am in the amazing presence of Dr. Olivia Tracy. So welcome today. Could you please tell us a little bit about yourself?
Hi, everyone. I'm Olivia. Thanks so much to Emily and the team for having me on today. I'm a first year resident at Hospital for Special Surgery in New York. I did my medical school training at Downstate, also in New York, grew up on the Upper East Side, so I'm a New Yorker through and through.
I love it. I love it. Well, that hospital is very, very happy to have you there. What kind of got you into medicine and into your specialty?
It's a good question. So I'm one of those people who knew that she wanted to be a doctor from a very young age. When I was 8 years old, my father passed away really suddenly. He had an aortic dissection out of the blue. And though there were doctors in my family, extended family members like grandparents, great uncles, and cousins, I remember it was the first time in my childhood in which none of the doctors in the family kind of knew what to do or had any guidance of how to go forward with something that is so sudden and so tragic. And so for me, when I was small, I remember thinking, like I don't want anyone else to feel the way that my family is feeling, and that's what drew me to medicine. I didn't know that I wanted to do orthopedics for quite some time, though. I had shadowed a little bit in college at Bronx, Lebanon, which is now called Bronx Care Hospital in the Bronx, in orthopedics, and really enjoyed it. Um, Came into medical school wanting to keep an open mind, but basically just fell in love with the specialty. Orthopedics is a really beautiful field, and it's an honor to be a part of it.
Awesome. Well, I'm sorry to hear about your dad, but very,
Thanks.
very special that that's kind of what led you into it and to kind of help people figure out what's wrong with them that they don't know. And in terms of orthopedics, you obviously this podcast has all women on it, and women in orthopedics is not something that has been, very big in the past. I know it's been getting more popular to have women in ortho, but kind of what has that been like for you, kind of from the start when you wanted to do orthopedics? Was there like any stigma that you faced, or what was that like?
Yeah, it's a good question. We're working very hard to change the proportion of women in the field, and I think overall we've been doing a good job. Not just myself individually, but more so there are national groups and physicians on a national level who are really pushing for more women in the field. I was very lucky in that at Downstate, I there were a couple of female residents that were huge support systems for me and really helped kind of guide me through the field. When I was an M1, they were both PGY fours and fives, I believe, at the time, and they provided a lot of great insight and guidance and also kind of showed me that it doesn't matter what you look like or where you come from, like anybody can do orthopedics if they really want to. Um, I also had some great mentorship from an attending level of both male and female attendings who were super supportive of me going through the process. And then finally, on a more national level, there are groups like RJOS through the Jackson Orthopedic Society and the Perry Initiative that are really involved with getting young women, whether they're high school, college, or med school age, involved in orthopedics. So being able to meet other medical students and other residents and attendings who are really involved with those organizations at conferences throughout the country was really inspiring to me too.
I love that. I love that. Well, you just answered a lot of my questions in in one.
Sorry.
Because no, that's awesome. I think that mentorship and role models is obviously something that's very important, and I know it's important to you too. Kind of what did those relationships look like throughout medical school? Like, was there anything specific that they did to kind of guide you?
Yeah, I think mentorship can take many different forms, and part of it is specific to what the mentee is looking for at the time, but also what the mentor is able to give to them. So a lot of the residents and the attendings that I worked with, I met first through research, and research mentorship is very different than kind of professional growth and life development mentorship. But in working on research projects with them and really like learning how to become a better researcher, um, these individuals were more accessible to me and made me feel more comfortable being able to share kind of other aspects of my life and other aspirations with them. And then once I was a third year student and I was almost done with my clinicals, thinking about doing OA rotations after my research year, they were really helpful in kind of narrowing down what programs would be the best type of fit for me and which programs would align with my goals for residency. And then I also feel like there's a different form of mentorship that kind of comes from observation. I feel like I learned so much just by watching these residents and these attendings go about their daily lives and seeing like what aspects of their job brought them fulfillment and brought them joy, how they were able to balance their family and other priorities outside medicine with what they were doing on an everyday basis. And that was purely just from them being kind enough to like share their life and their life experiences with me. But that also really helped kind of frame my perception going into residency of how am I going to be able to balance other commitments and other things that are important to me with orthopedics, which is certainly something that one is able to do. Just takes a little bit of foresight and thinking about it.
Well, I think it's obviously good to have role models, especially in your field, kind of show how you can balance things in life, especially in orthopedics, which is very busy. And in a few other episodes, we talked with people about how to balance like being a mother, being a wife, things like that. So I think that's speaks a lot. How do you feel like you are going to translate that into your career as an attending or as a resident? Like, are you looking for continued mentorship opportunities for you to be a mentor, or also like how you are still a mentee?
Absolutely. I mean, I think that the relationship with the mentors that I have formed so far are so special and important to me that I hope that I'll be their mentee forever, kind of as long as they still want to have me.
Yeah.
But I've also really grown to love medical education, and I really like working with medical students. And I very much wanted to be in a residency program in which I would have the ability to work with students, and then also once I'm a chief resident, to be in a program where there's a big culture of upperclassmen kind of mentoring the junior residents as they're going through the process. So I hope that that is something that will kind of stick with me throughout these 5 years. And then I think, at least as of now, that I really want to go into academic medicine and have an academic practice. And being able to do that as an attending would mean that I would continue to work with trainees, whether they're med students, residents, or fellows, kind of throughout the rest of my career, which is something that I would bring me a lot of joy. So I look forward to that.
As someone who has felt like your mentee at times, because for anyone who doesn't know, Olivia and I worked together during her research year and my gap year before medical
Mhm.
school. And she's very good at giving advice, that's for sure, and has honestly taught me everything about research that I know, and also makes me want to do orthopedics really bad. So I have no doubt that
Great.
she'll be an awesome mentor and continue to be a mentee. So I
Thank
love
you.
that. And I guess more kind of about the female in orthopedics. Is that something that you feel like is kind of like present today when you are at the hospital, or is that something that kind of, doesn't really cross your mind anymore? Because I know that some of the med students at my school, are talking about specific programs that have maybe one female resident in like all the groups versus I know HSS has more than that. So how do you think about that?
Yeah, no, I feel very lucky to be in a program that's almost 50% women and men in terms of the residency breakdown. And we have tons of female attendings. I don't know the exact statistic off the top of my head, but it is definitely something that I don't really feel as strongly. The women in my program are also like incredibly kind and easy to talk to and give great advice. And so I feel very comfortable going to them if I have questions about things related to like family life or anything about being a women in medicine and orthopedics more specifically. But that is true. There are some programs in the country that don't have as many women in them. And my understanding that it is that everyone is trying to kind of push to change that. But it is definitely would be a different experience to be like the only female resident in a program or one of two or one of three female residents in a program. So I feel very lucky that I had the kind of support that I have now.
Well, that's awesome. I mean, HSS has a great culture, as you obviously know. And I think that is very special to make women feel empowered in their specialty. And I hope that, continued opportunities and balance and just making it easier to, you know, be an orthopedic resident while also doing life things. Um,
Mhm.
so kind of going back, you touched on wanting to do academic medicine.
Mhm.
Kind of what part of the practice of academic medicine versus like a different type of medicine more speaks to you? And could you kind of explain to our listeners what it means for a program to be more academic medicine versus what other options could be?
Sure. Yeah. So the way that I kind of think about it is an academic practice versus a private practice. It becomes much more nuanced than that when you actually kind of dig deep into it. But those are two different buckets that most attending positions kind of fall into. So an academic practice is one that is affiliated with the hospital, which all of the attendings who work um, at this hospital also have a certain amount of like teaching requirements that's built into their job. So they work with residents, fellows, medical students, something along those lines. There's also much more infrastructure to do research in academic institutions because there's funding that's based through the hospital itself. And it's a little bit easier to apply for national grants and things of that sort, just because you have like an entire institution kind of backing you. In contrast, private practice is usually run by a group of physicians who are like the sole proprietors of their business. So everything all the money that they make is also the money that is then used to kind of finance their practice itself. So that includes like the building where they work, paying for all of their staff, paying for ambulatory surgery centers, kind of things of that sort. And it is certainly possible to have teaching affiliations and to do research in a private practice. You're just kind of an independent group, so to go about kind of forming those connections with a nearby institution, like a hospital or a school, to be able to form those, as opposed to an academic practice where you're working kind of directly at a hospital. So for me, because wanting to have a certain level of like teaching and mentorship that's already built into my practice, being at an academic institution as an attending, at least to the way that it seems to me now, seems to be like the right kind of fit for me. I also foresee myself doing clinical research like throughout residency and well into my job and career as an attending, and being at an academic institution would kind of help facilitate that more easily.
Thank you for explaining that. Um, yeah, I know that research is a big part of your career or your path to orthopedics as of right now, especially since you took a research year in between your third and fourth years.
Mhm.
Um, could you tell us a little bit more about like kind of what made you want to take that research year and if it was related to orthopedics and kind of what that year was like for you?
Yeah, so I decided in my third year of med school, right around the time when I was became really committed to applying to orthopedics for residency, that I wanted to take the research year. And mostly it was because I had done some research at downstate in medical school, but I had never worked on very like complex research projects, complex in terms of their design. So I never worked on like a randomized control trial, for example, or started my own prospective study. And I wanted to learn what it was like to have those experiences and also to see if working on research in that sort of capacity was going to be something that I would want to continue in residency and beyond. I also wanted to really hone my research skills and feel confident that I could, design a project, kind of carry it out from start to finish, and then be able to write a completed manuscript all on my own. And that is absolutely what I gained from the research here. It was an incredible experience for me. I love working with you and the rest of our RAs, but I learned so much, both about what goes into making high quality research and project design, um, as well as I learned so much about myself and that this is something that I really do enjoy doing, and foresee being a big part of my life in the future. So it was a really wonderful experience overall. Highly recommend it for anyone who is more research inclined.
No, that's awesome. Productive is an understatement, in my opinion, for the year. That's super awesome. And I also think, at least for me, it was not exactly a research year, but a gap year that had a lot of research in it. And I think it
Mhm.
kind of sets you up differently going into medical school and learning because you've already had an exposure to, some pathology and kind of like thinking about how physicians, think through certain diagnoses or processes for deciding how to, change their clinical practice. Do you feel like your research background has impacted the way you now are as a resident, like the way you interact with patients in a way?
That's a good question. I think it is maybe less so about patient interactions, but has helped give me a better foundational understanding of how attendings approach complex problems that arise in their day-to-day practice. And if you see a patient in clinic with some sort of unique pathology, or they have maybe a more commonplace pathology, but it's presenting in a unique way and requires like a different approach surgically, working with people who have had those experiences and kind of listening to how they think through a problem, and how they're going to adapt their surgical approaches or use different devices or different designs to kind of combat and tackle it. I think a lot of that, my understanding of how those processes works comes from the things that I learned during the research year. And kind of like you were saying, it helps add increased exposure into a field, that you exposure that you or I wouldn't have otherwise had right before our training. And so it's really helpful to come in with like a knowledge base and a framework for kind of approaching those types of problems.
I like that because I'm sure it also sparks you to come up with your own like new research ideas as
Hmm.
you're practicing and thinking of that. And as a resident, you must be more than busy and super overwhelmed. What does your research look like right now as, an intern and kind of your schedule, and how do you think that that will look like in the next few years?
Yeah, I mean, I think a lot of it is being kind of cognizant of there are always going to be certain blocks of residency that are more time consuming than others. So when you're in a period where you have a little bit more free time outside of your clinical responsibilities, that's a good time to kind of incorporate your research. So I started intern year on general surgery, which was a bigger and heavier rotation for us. So I didn't really do a whole lot outside of work those 3 months, first 3 months. And now I've been on site a bit of a lighter service. And so I've reached back out to some of our peds researchers to see if there are projects that I can help them with. And so I've just been sort of helping them out here and there. I'm about to go into another harder block of ours for the next 6 weeks. So I think the my involvement in research will kind of ebb and flow over time, to kind of just depending on clinical responsibilities. And from talking to some of my co-interns and then some of the other residents in my program, I think that's how a lot of people approach it. As long as there isn't a big deadline coming up, which of course that can kind of change the course of things is you build in time for it in blocks when you have a little bit more space.
Yeah, well, that definitely makes sense because you got more than enough on your plate. Do you have
Mhm.
specific conferences and like manuscript goals in mind, or are you kind of just doing what comes your way?
Yeah, it's a good question. At least for this year, I more so have just been trying to help out with projects as much as I can, and the hope is that we'll submit some things to the academy or some to like the national pediatric meetings that come up every year. When I get a little bit further along in residency, there are some residents that I've seen who have maybe more specific conferences in mind, and I think that that's sort of a natural progression once everyone kind of decides on what subspecialty they want to go into. And for me, I just started intern year. I'm super open-minded and I'm not sure what I'm going to end up doing long-term in orthopedics. But, for my co-residents who are going into joint replacement, for example, like AUKUS is one of the big joint replacement conferences that they look to kind of send their research projects to. So I think it becomes more narrow as we all kind of move through the process and become more getting closer to our subspecialty.
I'm definitely realizing now already too that being in medical school versus a gap year that had the time for research, it's really hard to
Mhm.
find time to do it. Kind of balance that in. This is kind of a more broader question, but what has
Mhm.
been your favorite thing about being a resident so far, and what has been your biggest challenge?
Oh, that's a very good question. Honestly, it's hard to choose one favorite thing. Overall, I would say I feel like for anyone who's in residency, like we've all spent so much time working up to this point, spent all of medical school like thinking and learning and wanting to be a doctor. And then as you get towards the end of medical school, preparing to go be a resident in the field of your choice. And it's so nice to actually be a doctor and to feel like the things that you're doing every day are really directly and tangibly helping people. Being able to interact with patients in that way and feel like I'm like a significant member of their care team now, and I'm really involved in being able to help them achieve their goals, and provide them the care that they need is really rewarding. So I would say probably that's my most favorite thing overall. I also like I love my co-residents and love the attendings that I work with, and I feel so lucky to be able to be training alongside some like really brilliant and kind and dedicated people that they also help kind of inspire me to keep going every day. So those are my most favorite things. Biggest challenge, honestly, I feel like the challenges are not, I haven't experienced any challenges that are super unique to me. I think it's more of a general experience of like learning how to function with maybe slightly less sleep than we were getting beforehand, and being more cognizant of trying being able to keep doing the things that we all want to do outside of work while kind of keeping up with our clinical responsibilities, whether that's research, whether that's spending time with friends and family, or other hobbies or things that are kind of important to you. And as I was kind of mentioning before with the research, there are times where things will ebb and flow in residency. And
Yeah.
that's kind of how I think about balance is there are some periods of time in which my like clinical work and clinical responsibilities are going to take up the majority of my time, and that's okay. And then there will be certain blocks where I will still be doing clinical work and clinical responsibilities, but will have maybe more weekends free that I can use to spend time with friends and family or can spend reading or exploring New York, things like that. So it will all kind of just ebb and flow through time.
Oh, I love that. Um, yeah, it's definitely something that's on my mind about the whole balance thing, which I also wanted to ask you, do you have any advice or like things to think about if, the tenacity of, I guess, a specialty is something that someone is thinking about, like, if surgery has a lot more hours than like a different one, for example, or kind of like how did you think about that going into it?
Mm. I think that if there's a field of medicine, regardless of what that field is, that you as an individual feel like is your calling,
Hmm.
you will be able to make it work. You know, like residency is hard, but it is a unique period of time, right? It's 5 years for orthopedics, it's 3 years for internal medicine. It's, kind of depending on the subspecialty you go into, anywhere probably between like 3 and maybe 6 or 7 years maximum, I can think of. And then attendingship looks very different than that. So if there is a niche and like a home for you within medicine, then I would encourage anyone to go and pursue their goals. With the knowledge that residency may be tough for a little while, but it is a finite period of time. And attending life can look very different than that. That being said, it's important to have a support system in residency, whether that's family, a partner, friends, a pet, whatever support looks like for you. Being able to lean on those people when you are in those kind of dips and valleys in the process kind of helps make everything a little bit easier.
No, absolutely. I mean, medical school is not easy either, and you've already
Right.
completed that, so
Yeah.
you're doing great. I love that. Do you have any other advice, I guess, for anyone that wants to go into medicine, is in medical school, kind of just anything
Just
you've learned?
generally,
You have a lot of wisdom and a lot of experience. Just love hearing everything you always have to say.
thank you, even though I'm just an intern. Yeah, I mean, I think that being able to be a doctor is like truly a gift. And I think that the people who are drawn to medical school are people who feel compelled on a deep level to help other people. And that is such a beautiful thing to have and a beautiful thing to pursue. So I would say that, like, for anyone who's interested in applying to medical school, like, don't let anybody change your mind. You know, if that's the place where you feel like you belong, then go for it. Um, for people in medical school, I say the same thing about like applying to residency. And just I try to remember that in those periods in which things are tough, and there will always be periods where things are tough, remember how much good you're doing for the world.
I love it. I love it. Olivia's the best. Um, Thank you.
Thanks.
Well,
Yeah.
I've really enjoyed talking to you today and asking you about, your
Thank you.
experience as a resident and what it's been like in academic medicine. I think that's obviously a super unique place to be, and someone so passionate about research and just continuing to learn because, being a doctor, you never stop learning. And
Hmm.
that's a big part of it too as stuff continues to advance. Um, yeah, but thank you very much for coming on today. We
Thanks so much for having me.